if we do frozen shoulder, we are going to get an MRI or an X-ray or something, another advanced technique to figure out that there's something else going on. And so let's say for our sake today, there's nothing else going on. It's just frozen shoulder. MRI looks great, and sometimes we can see some changes in the MRI. We can see a little bit of thickening of the capsule. So sometimes maybe we might be able to see that on MRI. Sometimes not. Sometimes it is just a diagnosis in the office, and then we confirm that there's nothing else, it's just frozen shoulder, and they go, okay, what do we do? Well, we could do nothing, right? We can say, you know what, you got frozen shoulder, most likely in 3 years it'll go away. So that's an option. But oftentimes in the freezing, in the frozen area, it's really painful. And so people don't really like, do nothing, just ignore it, and 2 years, 3 years from now, it'll be fine, which is not really what we went to school to do. We went to school to help. And so there are some simple things. Therapy, range of motion, stretching. You can do it on your own, right? Stretch, that helps some. Anti-inflammatories, if you can take them, Aleve, Advil, various other ones around. I'm not endorsing any specific anti-inflammatory. Just like if you broke something, you took Aleve or Advil, it probably is not going to make a huge difference. It can make some, but sometimes we do add some other kind of pain medicine, stronger pain medicine, non-narcotic or not narcotic pain medicine to help minimize the pain as you're going through this. So sometimes that can be helpful. But beyond that, we talk about injections. There's a huge debate on injections, right? Injection with steroid, because that's typically what we inject. Anti-inflammatory, you'd think that would make sense. If you have inflammation in your shoulder, we inject an anti-inflammatory in your shoulder. That should help. There are lots of confusion, concern about steroid injections in joints and around tendons, whatever. We'll talk about that in an upcoming episode if anybody really cares about it. But in general, steroid injection can be helpful. It is not going to thaw the shoulder. It's not as if it's going to go, well, everything's fine. It will decrease inflammation, so decreased pain may make it easier to do therapy, make it easier to make that motion, but it's not a panacea. And sometimes, as you can imagine, if you inject an irritated shoulder, the actual injection, not the steroid, but the actual just a physical part of the injection hurts and irritates the shoulder. So there's some confusion out there that maybe a steroid makes things worse. It's not the steroid that's making things worse. Most likely, it's not the steroid that's making things worse. Most likely, it's actually the technique of the injection and how it was done, or just sometimes people can't tolerate it. How do you know where you're injecting your steroid? Should you use ultrasound? And there's some debate there's some Facebook groups, and I'll talk about one in 1 second, whether or not you should use ultrasound. They say, I'm going to have an ultrasound guided injection. Most of the time, for most people, meaning if they're not really, really big, so we can't even tell where the shoulder is, and most people like me who have done it for 15 years or 10 years, even 5 years, who can know what they're doing orthopedically, we don't need ultrasound. And there's actually interesting studies way back when you inject the shoulder, as long as you're pretty close, it probably doesn't really make any difference if you get it exactly where it's supposed to go. Steroid injection can be helpful. May not be all the end all be all, but can be helpful. So that is an option that you should talk with your doctor about if you're getting ready to help treat your frozen shoulder. You can do oral steroids you take by mouth. That affects the whole system. It has to go through the whole system to get your shoulder. So I'm less excited about that, but you certainly can do that. There's something called, which I've never done, but called hydrodilation. So you, instead of injecting steroids, you inject sterile water. So you have a syringe full of sterile water and you try to inject the joint and blow it up. So you expand it. I'm not familiar with the results of that. It's not a common thing to do. I could only imagine it would hurt a lot to try and expand a shoulder that's not wanting to expand. But anyway, that's an option. Lastly, it has to do with surgery. There's two different kind of thought processes. One, if you have a frozen shoulder and you have a frozen shoulder because of nothing, right? You don't know why, it just happens. Then usually a good result can be from a manipulation. Manipulation means we give you medicine, you fall asleep, you're in an operating room. When you're asleep, I move your shoulder. So I physically move the shoulder, break up the scar tissue, get the motion back. That usually works very well in somebody who has an atraumatic or not a trauma that creates the frozen shoulder. So that can work very well. Obviously, no one wants to have surgery. No one wants to go through it. And when you do the frozen shoulder manipulation, it's not over, right? Because if you don't move your shoulder after the manipulation, then the shoulder will get stiff again. So we have to have therapy involved, most importantly after manipulation, the day of, a few days after, every day, to try and maintain the motion that we have. Because if we don't, then it just comes back. Hurts some. Usually we do a block. We'll talk about blocks in the future. Injection here numbs up your shoulder so that when you're awake after surgery, you don't have pain. If you don't have pain, it's much easier to maintain that motion. So block, and again, we'll talk more details about blocks and how to treat shoulders in an upcoming episode. So manipulation, so that works well, except in my experience and many experiences, it doesn't work as well in people who have a traumatic frozen shoulder. Let's say someone dislocated the shoulder or hit their shoulder, broke their shoulder. Let's say someone broke the shoulder, right? Broken the shoulder, if this is the ball and this is the socket, and you break it right here. And so you can't move it for a while because it's broken. And so you let it heal, but they get stiff. So the real stiff, the fracture is relatively healed, but they're still stiff. Most of the time, if you just do manipulation, you don't get enough motion back. You don't get it because there's more thickened scar tissue. Then you do a manipulation plus an arthroscopic lysis of adhesions. What in the world is that? So arthroscopic means 3 little poke holes, right? Little poke holes around your shoulder so we can get the camera in, we get an instrument into the shoulder to see what we're doing. And if we look at the socket in the ball, the capsule all around it. So we can release the capsule around it and release another structure called the rotator cuff interval, which is not important, but release essentially scar tissue around your shoulder using a little cautery, a special arthroscopic cautery. Release that, and that will help us release more and get a better result. Frozen shoulder, recap. Frozen shoulder, painful, stiff shoulder. Can't move it, I can't move it, you can't move it, nobody can move it. Treatment, nothing, and it'll take 3 years or so. We try to help with injections, anti-inflammatories. If that doesn't help, then we talk about manipulation and arthroscopic lysis adhesions. So if you have a frozen shoulder, there is a good group on on Facebook. It's called Frozen Shoulder Group, I think. They have lots of people who have it throughout all around the world. I think it's about 4,000 members. Bounce ideas off back and forth about what they think is good, what's not good. So it's very interesting. I think an interesting group to join. Otherwise, if you have a shoulder problem that you're stiff or some other shoulder problem that you're not sure what's going on, please go see your orthopedic surgeon. Where there are a lot of us around, we're always happy to help. Always happy to have new people. Frozen shoulders, not common, but it's not uncommon either. So most orthopedic surgeons who do a lot of shoulder work will be very familiar with what it is and be able to help you. Anyway, thank you. Sorry, this one's a little bit long. We'll try to make them a little bit shorter. By the way, if anybody has any thoughts or ideas of what you would like to have me talk about in the shoulder realm, please leave a message at the Facebook page or the YouTube channel, whatever, or the Instagram, and we'll try to get that on. We'll be talking maybe about trying to do some Facebook Lives or something like that in the future so we can have more immediate one-on-one conversations. So we will see you in the next one. Thanks. Bye.